Hello everyone, my name is Ashish Rahi and today my topic is about the unit dose drug distribution. The unit dose drug distribution is a method of distribution the drug to the patient at one dose at a time only. Like one dose, in one dose there is a capsule, there is a tablet and there is a small syrup like 1 or 2 days syrup are there. This is the types of unit dose drug distribution method. There are two types, that is CUDD and DUDD. In CUDD is the centralized unit dose dispensing. In this method, the drugs are stored in the main pharmacy at dispense when dose is required to give a patient by better with the medication card. The decentralized, in this method, a small pharmacy on each floor of the hospital, and the drugs are supplied to the pharmacy from main pharmacy on receiving the demand. From this small pharmacy, drugs are dispensed in unit dose when required to give a patient. Advantage are pharmacists check the physician's prescription for administration drug by nurse. Less chances and stolen of drug, low investment because of storage facility not required at each floor or ward. Nurses have more time to care patient because all doses are prepared in pharmacy. Disadvantage are a pharmacist has to give more time handling each dose individually than sending the bulk drug to a ward. Increase staff, the system require number of staff to manage the system. Increase because the system additionally equipment to deliver drug like them better. The drug distribution to when this type of drug distribution drugs are provided to the patient are not admitted in hospital and are given generally or emergency treatment. The step for dispensing the drug to our patient is registered by registration for staff. The patient name is registered by registration staff and the patient is sent to the physician. The physician checks the patient and write a prescription. The patient takes the prescription to the pharmacy. The pharmacy reviews the prescription carefully and records the prescription and provides the drug. So this is the unit dose drug dispensing method of for a pharmacist. Thank you.